Hi, very good morning. I am Nurul Atira binti Muhammad Azmi. I would like to present about healthy effect of pandemic COVID-19 to Malaysian. Okay, I will present our members. We are six our member. First of all, is our member is Lisa Wati binti Zakaria, and second Nur Fazrahim binti Muhammad Zuki. Third is me, Nurul Atira binti Muhammad Azmi. Fourth, Shahrul Amirul Azwa binti Muhammad. Fifth, Nur Hazlinda binti Abdul Jalal. Sixth, Masita binti Abdul Razak. Okay, I would like present to first presenter is my friend. Thank you. Enjoy the movie.
Assalamualaikum and good evening. My name is Nofaz Rahim. Today I would like to discuss about the how to the COVID-19 affect Malaysian health. As we know, today we are familiar hearing about the pandemic COVID-19. From pandemic COVID-19 have some effect, have some positive or negative effect to us. Now I would like to show about our research and my part is the background study. And the first item from a World Health Organization or WHO about public mental health terms, psychological impact to that is elevated rules of stress or depression, and the effect from quarantine at home. Many people usually activities, routine or livelihoods main affected like loneliness, depression, harmful alcohol and drug as and safe. From Amrita Kaur, the Straits Times or Asian News Network, she said COVID-19 carries health risks leading to obesity, high blood pressure and diabetes and heart disease. Physical inactivity also contribute to anxiety and depression. And the third part, Dr. Wee from Singapore, when COVID-19 continues, many people taking the multiple supplement like vitamin C, omega 3 or multivitamin. It is dangerous because when the vitamin taken together at the same times, they can lead to side effect like gastric, nausea, irritation, or constipation. Okay, thank you.
Hi, my name is Hirwatira. I will back to my part. My part is a background for pandemic COVID-19. Okay, I will read for my part. Okay, Ready Children Hospital di San Diego, California. The hospital has seen a sharp decline in pediatric for respiratory illness, includes diseases like influenza, parainfluenza, respiratory syncytial virus, and human metapneumovirus. Beyond nasal signs beyond that, diseases reducing effects of financial distinct, children and families are taking advice on hand wash, personal hygiene, and other prevention measures seriously. Itu saja daripada saya. Terima kasih.
Feeling their psychological need of relatedness. Kolia H. White Chan in 2019 found that one psychology need for connectedness serve as important determinant for sustained use.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Haslinda. I would like to share our opinions regarding the statement of the problem, what we discussed in our group. Okay, firstly, it's never easy facing the unknown and amid the fear in the midst of this pandemic with a novel virus. There has been a host a different retention. For the government, there has been a need to balance between containing the problem in the public of the health and the performance of the economy. There is also a need to ensure that anxiety and subsequent panic are not induced by the irresponsible spread of the fake news. On the societal level, this can cause a loss of confidence in the government decision and policy on how it's handled the pandemic, economic recessions, retrenchment and unemployment, said by the Gravet and Rosner year 2020. On the individual level, they may cause panic buying and hoarding by July 2020, psychological distress Ministry of Health Malaysia 2020, and instill fear among certain group within the population. Furthermore, in the Malaysia and many other infect country, we believe that there are two problematic category of information sharing on the social media. That was the situation. Firstly, the sharing of personal information of the patient and their family by the public, the authority of the third party, and secondly, the sharing of the fake news or of false information. The sharing of personal information raises the risk of stigmatizations, discrimination, and blame. There is an increased risk the public may start blaming patients with COVID-19 or blaming for initiating cluster of the infection, and indeed in some case the patient has had the response openly to such allegations to defend themselves by Atan 20 Sukumaran 2020. Okay, the sharing of the false information is not unique particularly but for this pandemic, but the impact is causing the public to be anxious and fearful by Clipper 2020 de la Gaza by 2020. Thank you.
Research objective. Our research objective is to identify the negative effects of pandemic COVID-19 to health among Malaysians. This objective is very important for us to comply this research requirement in analyzing all the data from many kinds of research. Research questions. What are the negative impacts of the pandemic on health among Malaysians? Thank you.
Hi everyone, my name is Shahrul Amirul Azwan. I'm from health group. So our health group methodology is to study about daily affected patient with coronavirus disease in Malaysia. So the research instrument, we are using quantitative approaches, and we are using secondary data because the data has been collected and it's been held by KKM. We are not using primary because we are not build the questionnaire. Okay. How are we going to distribute the data? Number one, all Malaysia citizen is encouraged to install the apps held by Malaysian Minister of Health, which is MySejahtera. Number two is during patient come over to the hospital to get the treatment, so they will get the questionnaire. So who the respondent are? How many are they? So according to Sinar Harian, in Malaysia approximately we have 32.7 million citizen. So another one is close contact person with corona patient, and 3 those are back from traveling at overseas. So after they are back to the Malaysia, and they have to go into the swab test, and after that they have to wear the red bangle. Okay. So how are we going to analyze? Gathering all the collected data by the hospital over the Malaysia, and also in MySejahtera apps too. So KKM will gather all the info and all the data by daily. And last one, result will be present and shown on daily press conference by KKM at their official website, Facebook or other KKM media social tools. As the picture we